What is that?
All right. So I just started the session and our people are going to start filtering in. I'll give them just a minute to come in. We are starting a few minutes late, so we'll go ahead and get started pretty promptly. Just another 15 seconds or so. All right, we're going to go ahead and get started. And as people come in, welcome. My name is Marie Gress. I'm a licensed master level social worker with specialties in macro practice, older adults, and technology. I am the owner of Cover and the founder of WizeCove, which most of you are here because you are members of WizeCove. So welcome, welcome. With me today, we have Nicole. She is an MSW candidate at Adelphi University in New York, and she has been spending her semester just going really deep into understanding dementia, identifying dementia. We're going to be talking throughout the series about risk factors and what you can do. But today, the big topic in understanding dementia is the 4 A's. So Nicole, I'm going to hand it over to you. I'm going to be moderating for questions, comments throughout, and I'll pop in and interrupt you as we go.
Okay, thank you, Marie. Hi, everyone. I'm Nicole. I know Marie briefed on it. I am a master's in social work student at Adelphi University on Long Island, New York. And I have, Marie and I together have broken this PowerPoint into 3 segments, one every Monday, focusing on different topics regarding dementia. So today I have chosen the basic beginning, understanding dementia, right? You have to understand what dementia is to know more about it and know the rest of it. So I will go ahead and start. So some objectives today that we are covering are what dementia is, what dementia looks like, how to detect dementia, and the 4 A's of dementia. I do have some pre-questions. I'm not able right now to see anyone because I'm sharing screen, but you know, I know Marie's monitoring. So just by some show of hands, does anyone know the 4 A's of dementia, or has anyone ever heard of the 4 A's of dementia?
I had not heard of the 4 A's of dementia. I haven't heard the model like that. That was a unique thing you brought to me.
Thank you. Yes, that's actually something I learned as well this year. You know, as well as getting familiar with other dementia terms and other things regarding dementia, which brings me to my second question. Do you believe dementia is a normal part of aging?
We're getting no's.
No. Okay. Good answer. It's not. That's right. And on a scale from 1 to 10, how familiar are you with the topic of dementia? A guesstimate.
With 1 being I know nothing,
Yes.
and 10 being I know all the things.
Yes. And a 5 being an in-between.
So we have 6s, 7s, 8s, a 9.
Great. They might be more skilled than I am. Okay. So I just want to share what dementia means to me significantly. Kind of 2 reasons I chose to focus in on dementia. The first one being that in my undergrad program at Johnson & Wales University in Rhode Island, we learned about a variety of issues regarding mental health, but dementia was something that really stood out to me that we learned about my senior year, and I found it very fascinating. What I've learned in my internship is that the elderly community is, in fact, the most discriminated against. So I thought that dementia was a good topic to focus in on. And I have a very close relationship with my maternal grandmother, and she is turning 80 this year. We have started to notice that there are some signs that she most likely has dementia. She experiences a lot of memory loss. I actually was out to dinner with her last night and kind of caught her, instantly forgetting things that I had just said not even a minute ago. So it's definitely something important to me to know about, to be educated on the matter. I think it's great for everyone to really be educated, especially if you have grandparents you're close with or neighbors. So I just want to start out with this quote. Those with dementia are still people, and they still have stories, and they still have character, and they are all individuals, and they are all unique. And they just need to be interacted with on a human level. That was a quote by Carrie Mulligan. I think this quote is very important, especially to start off with, because, like I had said, the elderly community is very discriminated against. And we tend to, as a community, not everyone, but sometimes generalize these people, and instead of looking at their individual stories and their individual journeys, which can really affect mental health greatly. And before I talk about dementia defined, I just want to discuss why I chose purple. Purple is the official color of Alzheimer's. It's a mix of red, which is passion, and blue, which is calm stability. Red and blue make purple. And this is a strong and unrelenting fight against Alzheimer's. So that is why I chose purple. All right, now stepping into the PowerPoint.
Interruption here. As a company who helps senior sites, home health, and these small organizations with some foundational branding, I love that you thought about what those two colors meant and combine them to make something really empowering. I just really appreciate that.
Thank you. Thank you very much. And it also is a plus because it looks very nice. Very happy color for a little bit of a harder topic to discuss. All right, so dementia defined. Dementia, this is a very common misconception. Dementia is in fact not a specific disease. So Alzheimer's, which is the most common form of dementia, would be the disease, but dementia is more so an umbrella term. That's something I also learned in my internship this year. Thank you, Marie. Again, it is an overall term which describes a wide range of symptoms associated with declining memory, thinking skills, and ability to perform everyday tasks. So there are a few different types of, not a few, there are many different types of dementia. Again, Alzheimer's being the lead, it accounts for 60 to 80% of dementia. And some other types of dementia are Lewy body disease, frontotemporal lobar degeneration, Parkinson's, which is a common one, Huntington's disease, and hippocampal sclerosis. These are all neurodegeneration, neural degeneration of the brain. So what is dementia? Dementia is a group of symptoms that affect memory, thinking, and interfere again with daily life. It's very, very common, unfortunately, especially in the United States. There are more than 3 million cases per year. In my third segment, I kind of discussed risk factors and why some leading causes that might lead to dementia. There are many different, it's hereditary, but again, that will be in the third segment. Treatments can help manage the condition, although there is no specific cure. It often requires lab testing or imaging. It's common for ages 60, 65 and older, although you can experience early onset as early as your 30s or 40s. It is more common in females, unfortunately, and family history may increase the likelihood. Urgent medical attention is recommended in some severe cases. As you can see in the right-hand corner, I do have a picture. Displaying is the man, a little bit confused, overall confusion, scratching his head, he's unsure. So that is kind of what it could look like. Some statistics. So dementia actually kills more people than breast cancer and, excuse me, I'm sorry about that mistake, but it should read prostate cancer combined. There are about 8.5 million people in the United States living with dementia. That was in 2020. And unfortunately, due to the pandemic, it has increased 16%. There is an estimate by 2050 that it will go up to 13.7 billion 17 million, excuse me, people will have dementia. So some symptoms, cognitive and sensory changes would be memory loss, generally noticed by the near and dear ones. So, like I had shared earlier, my grandmother, I'm very close with her. I see her often. So little by little, I am noticing these little forgetful moments, and it's become more common, unfortunately. Difficulty in communication, especially finding the right words to communicate, which I do go into with the 4A's later on in the slides. Reduced ability to organize, plan, reason, or solve problems. Difficulty handling complex tasks. Confusion and disorientation. Again, like I had shown in that picture before, that man had his hand on his head, kind of confused and disoriented, almost in a daze. Difficulty with coordination and motor functions. Loss of or reduced visual perception. I share a video later on in the slides which actually show that, physically show that. And metallic taste in the mouth, decreased sense of smell. I don't know why, but I found the metallic taste in the mouth very, very interesting. I never knew how that could tie in, but it is one of the symptoms. Symptoms continued. So these are some more psychological changes, changes in personality and behavior. There's actually something called Sundowning. I'm sure some of you might be familiar with that term. Later on in the day, if a loved one or someone you know does have Alzheimer's or dementia, they start to sundown, which, in other words, kind of irritable and cranky, and that's something I again noticed with my own grandmother. Depression, very common with dementia. You're in an overall daze, you're confused, you can't express yourself, you grow depressed. Not always, but often. Anxiety, you grow anxious, you experience hallucinations, mood swings, agitations, and apathy. So there are, again, some 10 signs of dementia, more in depth, more exemplified. Poor or decreased judgment, difficulty with simple tasks, problem communicating, misplacing things. They have keys showed there. Might have misplaced your keys. You think you misplaced your keys, but they could be right next to you. Again, you forget. You put them down for just a minute, forget. Day-to-day forgetfulness, problems with language, difficulty problem solving, confusion of time and place. You don't know where you are, you suddenly forget. Changes in personality and changes in mood or behavior. So some causes, I know this does go into my third segment, but I will touch upon it briefly now. Damage to brain cells is the primary cause of dementia. Could be old age in the case of Alzheimer's disease, family history, it is hereditary, damage to blood vessels of the brain, traumatic brain injury, or repetitive brain injury, as seen in boxers, which isn't comforting because I did just start boxing. But if you get into like a car accident, any trauma to the brain could really affect you, especially down the line. Infections, which cause high fever, metabolic disorders such as thyroid problems and diabetes, certain medications, which is also very interesting, vitamin deficiencies, alcohol abuse, brain tumor or cancer. And another one I don't have on there is diet. Again, that's something to take a look at in the third segment, but that is something I learned greatly about my undergrad program, and it's very, very interesting.
So I have a quick thing to add.
Yes.
That earlier in the presentation, you were saying that there's many types of dementia, and there are over 80 different types of dementia, each of them presenting with different symptoms, different progressions. And this diagnosis piece that you're about to get into is so important, to have it diagnosed by a professional so they can see what exactly is going on. Is it medication? Is it a UTI, urinary tract infection? Or is this something else? Is this something that is going very quickly? Is this going to be impacting you in X, Y, or Z ways going down the line? So I'm really interested in this diagnosis piece that you put in here.
Thank you. Thank you for saying that. Yes, it is extremely important. And luckily there are, by knowing the signs, again, by remaining educated on this and always learning, you do have a better chance at maybe diagnosing it, as well as, medically. You can also, there are various ways to have a look at it, basically. So these diagnoses aim to find at least 2 impaired mental functions that interfere with daily activities. And when we say daily activities, we mean, anything you do on a day-to-day basis: walking, talking, bathing, eating, everything part of the daily routine. So if 2 of these are impaired, that is something to monitor, as we do this every day. Procedures include common tests and procedures as follows. So patient history, family history, or any other injuries to the head, as I had briefed upon before. Or again, patient history. If my grandmother has Alzheimer's or dementia, that's something that I might want to monitor. That's something my mom might want to monitor. Cognitive and neuropsychological tests. So these evaluate thinking, memory, reasoning, judgment, language, and attention abilities. Focusing, wanting to monitor, are they in a daze? Are they confused? Neurological tests. So these check for visual perception, sight, movement, problem solving, senses, balance, reflexes, coordination, all of that. CT scans. They scan the brain to check for bleeding or tumors, so more of a physical view of it. Magnetic resonance imaging, or MRIs. They provide detailed images of abnormalities of the brain, so you kind of can look at, all right, does this look off? Does everything look healthy in the brain? Do things not look healthy in the brain? Positron emission tomography, or PET scan. It's done to check for brain activity. Laboratory examination. This includes blood and spinal fluid examinations to check for infections, nutritional deficiencies, and hormonal imbalance. Psychological examination. This determines mental health conditions, which can cause dementia. And baseline testing, which, after I explain this, I'll let Marie brief on it a little bit more, but it's a comprehensive evaluation of cognitive functions before noticing any changes or memory loss. So almost like a pre-test. Marie, if you want to get into that a little bit, please.
But it's something so easy to do with your doctor at your annual or every other year checkup. I recommend that people start doing them in their 40s. What this allows to happen is your doctor to have a baseline of where your cognition might be. These tests also look at different aspects of your brain function. So it's looking at how many of these things can you remember, the function of this item can you remember, and some of those things. And this baseline, it's exactly what it sounds like. This is where normal is. This is where you have been functioning. So as you get older, especially if Alzheimer's, dementia, any of those things are run in your family, if you have had a history of car accidents or football, concussions, boxing, like Nicole mentioned, those will eventually start having some sort of impact on your brain, and your doctors can watch for when signs might start happening. When do we need to start being a little bit more attentive to this? When do we have to schedule one of these extra tests because something isn't right? If you're waiting until 60 or 65 to do this baseline, there's a chance that you could already be progressing through your symptoms and no one quite noticed yet. And so your baseline is now something that they think your baseline, where your normal level is, has some of these other symptoms already involved in it. So if you start this baseline early, do it every other year with your doctor in your 40s, you're going to be able to catch things much sooner and be proactive about your brain health.
Thank you, Marie. And again, I like to share personal stories because I find that that's the best way to connect with my audience. So I just recently got into a car accident about a week ago, I believe, and my head, I'm fine, but I did hit my head. So baseline testing might be something I want to consider. I've always been an athlete. I've had, they say blows to the head. So that's something I want to consider getting, especially if my grandmother, might have dementia. That's something I might want to do early on with my doctors. Thank you, Marie.
You're on Medicare. It's something that Medicare does require your doctors to do. So if you're in your 40s and 50s, early 60s, you want to request your doctor to do this. It doesn't cost anything. I've never had a client say that it costs anything extra for them to do. It's just a couple of simple questions. So also, as you're working with older adults, make sure that their doctors are following through on those baseline tests.
Thank you. So some complications that do come with dementia or dementia type diseases are loss of appetite. That's very, very common. Malnutrition, weight loss, pneumonia, inability to perform tasks without help, inability to perform self-care or hygienic tasks such as bathing, dressing, using toilets, etc., and protecting yourself from harmful situations. So I know I mentioned here loss of appetite, weight loss, malnutrition, eating, and again, I do go into that with the four A's, but in simpler terms, your brain works with the rest of your body to complete these tasks, such as eating, such as walking. So, your brain might not be able to properly communicate how to eat. You might be hungry, but you might not know how to pick up your spoon or remember how to eat, which is why loss of appetite and weight loss, malnutrition are all extremely common with dementia patients. So I've been talking the whole time about the 4 A's of dementia. We will finally step into that. So these are just some recognizable behaviors just to narrow down, what to look out for, or if you notice something, it's good to keep in mind to always watch, monitor. So these are particular regions of the brain which change, and they can serve as an indication for possible dementia. So the first A is amnesia, short-term versus long-term memory. Forgetfulness versus memory loss. So what we mean by this is, as I had asked before, is dementia a normal part of aging? And many of you said no, and that is the right answer. It is not a normal part of aging. Forgetfulness does come with age. That is normal. It is normal to forget, oh, I forgot I had this appointment or this or that. But memory loss is not. If it is regular that someone is forgetting, someone elderly, regularly forgetting appointments, putting their keys down and forgetting where they are the next minute, that is memory loss, and that is not normal. And that is not a normal part of aging, rather. Again, as I briefed on the third bullet, forgetfulness is normal with aging, memory loss is not. Apraxia is the inability to remember how to conduct certain movements. Physical ability versus memory, right? So what I had talked about 2 slides ago, eating, it was a great example of that. You do see a lot of thin dementia or Alzheimer's patients because, they are hungry, but their brain is not properly communicating how to eat, how to pick up that spoon, how to bite, how to chew. So unfortunately, a lot of daily life functions are heavily affected. Walking, breathing, a lot of people with dementia might need to lean on someone or have arms linked so that they can keep their balance, because essentially they cannot do it on their own, especially as the disease progresses. Agnosia, however you want to pronounce it. I'm from New York. I might sound a little different. Your brain cannot process information received from your senses. You're unable to recognize smells, sounds, or even people. So speaking louder, essentially, if I'm having a conversation with a dementia patient and they can't hear me, speaking louder will not help, because it is not their hearing, it's the brain that is not processing. So you could speak as loud as you want, you can make the TV as loud. It's not their actual ears that aren't working, it's the brain connected to the hearing that turns on the hearing. Aphasia impacts the ability to express oneself. So, maybe not being able to match words properly in a sentence. Hello, my name is Nicole. Someone with dementia might not be able to put those words together, or might not be able to form that full sentence. Or if they do, they might struggle and they hesitate greatly, especially as the disease progresses. So a picture taker versus the camera, they might try and find the word for camera. They can't think of the word camera, so they'll say, the picture taker. Again, that's the brain not being able to fully identify or put together the words. Or they might even make up words. Again, picture taker, kind of a made up word. You get what they're getting at, but it's not the right word we're looking for. So I do have this dementia simulation video. It is a really, really good video. It is a little bit emotional, but it does do a great job at showing what it's actually like to have dementia and experiencing dementia. Before I show you, I'll just give you a little brief on it. It's a man named Blaine who is arguing a little bit back and forth with his mother. He doesn't understand fully how hard it is to live with dementia, and that is a great part of why he's arguing with her. He is aware that she has it. Again, he does not know what it is like. So a news channel comes in and decides to do a simulation where they, I skipped this part of the video because it's in the very beginning, but they actually put latex gloves on him, as well as another woman who participates in it. They tape all of their fingers together. So as well as having taped fingers, they have latex gloves, which makes it really hard to move their hands to finish completing tasks. They are suited basically with goggles, which give them a blurred vision effect, and kind of some confusion. They put substances in their shoes, which make it really hard to walk. I believe they put headphones on, which create a static effect, which is what a lot of dementia patients experience, especially as it progresses, which is why there's always confusion, because they hear voices and a lot of static. So I will play this video. If anyone has a hard time hearing it, Maria, just let me know, please. All right. Can everyone see and hear that? Well, see that?
Experience. It needs to be experienced. If it'll help me to understand, I would love to.
I agreed to undergo the experiment with him.
Could you have a seat, please?
Our journey into another world begins here in this bedroom where Blaine and I are suited up with some deceptively harmless-looking devices. Goggles simulating macular degeneration, glaucoma, and cataracts, conditions that older people with Alzheimer's often have. Likewise, latex gloves are placed on our hands, and our fingers are taped to make our hands feel arthritic, clumsy, hard to bend.
Remove your shoes.
A substance is placed inside our shoes to make it harder for us to walk.
Oof, that is uncomfortable.
And on our heads, they place earphones, which emit an incessant jabbering, a clamor of noise that some Alzheimer's patients say is constant.
Individuals with dementia say, we're hearing all this stuff and they can't turn it off.
Then we're each given 5 tasks to perform and only 12 minutes to accomplish them.
I'd like you to find the tie and put it on.
I can't hear you.
Blaine has a hard time concentrating from the start.
Your time begins now.
As he enters, Blaine is immediately disoriented. He staggers, reminding us of the way his mother looked on our tapes. Blaine tries to accomplish his first task, clearing the dishes off the table. But when he goes to put them away, he can't find the kitchen. So he gives up.
Well, I don't know where to put them.
Blaine finally finds the kitchen, but he can't remember why he's there. And again, the similarities to his mother were astounding.
She'd open cabinets, and then she would shut them. Mother, what are you doing? Nothing?
But Blaine is doing a lot better than I am.
What the heck is this?
It's only about 2 minutes into the experiment, and the noise from the headset is driving me crazy.
God!
So annoying.
As I try to accomplish my first task, find a white sweater, I work myself into a frenzy.
White sweater.
Remember, what I'm hearing is this.
Well,
And believe me, it drives everything else out of your head.
annoyed.
This is tough. I felt confused, kind of panicky. If I had to go through very much of that, I just might go crazy.
All right, that's not a sweater. That's not a white sweater.
When you do understand why people start talking to themselves.
This is not a white sweater. I was trying to organize my mind by saying, okay, all right. Not a white sweater. Not there. I don't know about that.
You're doing great.
PK was in the room, and at one point when I sat down in frustration on the sofa, and she said, you're doing great.
Why don't you start with finishing setting the table?
And she told me what else I was supposed to do. I'll remember that.
The reinforcement.
Yeah, because you feel so alone. And you
Just going back to my PowerPoint.
That video. I and any other attendees, I'd love to hear what you thought of that video while I talk about some of the takeaways I had. So PK Belleville is actually one of our partners on WizeCove. PK Belleville has the virtual dementia tour at Second Wind Dreams, and they provide us content. They speak with WizeCove about twice a year, and it's just so powerful and accurate. While I was doing my master's degree a number of years ago, we did a very similar virtual dementia tour, and it really is just so frustrating, but you kind of just go through it at your own pace and your own perspective. And we're all social workers in this master's degree, you know, so we're all like trying to be patient with ourselves. And what I love about this video is how angry the journalist got, because it is so frustrating. It's easy for some of us in the helping profession who have had some exposure to some of this to be understanding and patient. We know that this is a very short experience and it kind of puts things in perspective, but she hasn't had that kind of background in training, and just how angry she got. Like, she knows she's on camera and she's still throwing junk around and kicking things, and just like, that's not a white sweater, you know? And it just really feels so accurate to how we have seen some of our people with dementia react to how frustrating their whole life is now. Like, to the rest of us, this is just a short experience, an experiment, and that kind of stuff. But yeah, I just really love that video that you chose. Colleen said that it is so accurate and powerful.
Yeah. And I appreciate all the commentary. I think that video was really important to show, similar to what you girls both just said. I mean, there are a lot of emotions. I'm sure everyone else felt that way too. There were a lot of thoughts that came into my head when I first watched that video. You know, you can't help but feel sad and almost a little anxious. I was even getting anxious during the video because I thought, well, again, this journalist doesn't really have it. She's just experiencing it. So you can only imagine why the depression and the anxiety and hallucinations and all the mental health effects when dealing with dementia and having that as your everyday reality. So I do think the video, did a really good job at all of that. Exactly. It was her raw emotion in there, which is really important. It's really important for people to see, especially people like us who are in the mental health profession. Very important. And I'm open to questions. I would love to hear what people have to think about the video. If anyone has questions about the four types, the 4 A's of Alzheimer's, or anything in the PowerPoint. Because again, I can't see, but I know Marie will let me know if anyone has questions or comments.
Questions to come in. I did put in the chat the Second Wind Dreams virtual dementia tour. If that is something that you are interested in experiencing or hosting at your site in your community, click there. let them know that you're a member of WizeCove and you get a discount. Also, I'm going to share with you while we wait for questions, the slide deck and references to this presentation that Nicole put together. And she made a handout for you on the 4 A's of dementia that you are more than welcome to share with any of the other staff at your agency. Just a really quick snapshot of the 4 A's being amnesia, apraxia, agnosia, and aphasia, and what those mean, just so you can keep that in mind if you are working with someone with dementia. So you can go to those in the downloads. And also, while we wait for questions, one more thing to share with you is tomorrow, I put a little button there. Tomorrow is all about virtual senior services. We're going to talk about virtual senior centers. We're going to talk about other virtual services, how to make them as successful as possible, and even go into a couple of ways these look like. And we're going to also talk about some of the ways to leverage your seniors, your older adults, to make your program successful. It's a peer support model that my colleague, Dr. Fortuna at Dartmouth University, has put together, and I'm excited to share some of that knowledge with you guys tomorrow. All right, so back to the chat. I am not seeing any questions at this point, Nicole.
Okay. All right. Well, then we are just about through. So now I have my post questions. Can everyone name the 4 A's, or anyone name the 4 A's of dementia?
If you want to write it in the chat, we don't have polls for these questions today. Colleen says amnesia.
Yes, she's right.
We have an apraxia.
Yes.
Aphasia.
Yes.
And agnosia.
There we go. Good job, guys. Very good job. You'll take that away. That's a very good takeaway. All right. And is dementia a normal part of aging?
No, it is not.
Okay. And my third, on a scale from 1 to 10, how familiar are you with the topic of dementia?
Colleen says 9. Sherry says 9. And she says her mother has dementia.
I'm sorry. I'm sorry to hear that. You know, it's a good thing there are many, many resources, and just always continue to educate yourself. I think that's really important. All right.
So what are you talking about next week?
So next week I will be discussing caregiving with dementia. Actually, I know someone in the audience is saying that their mother has dementia, so I'm not sure, the situation, but I do touch upon caregiving. There are many different people that can be caregivers: children, grandchildren, neighbors, professional caregivers. So I talk about caregiving, and I actually interview a dementia caregiver who has watched her patient rapidly decline in the past few months. And she's a really upbeat person, and discusses self-care and just ways to stay positive as someone who is a caregiver and who watches that every day. I mean, she's very, very close with her client. She always explains her client, describes her as like a mother to her. So there are emotional tolls that take on her as well. So we talk about that, and just the importance of caregiving, and also how grateful we all are to have caregivers and people who dedicate their time to really put everything into another human being, It's really important, especially in social work. It's so important.
Yeah, and senior services.
Very.
All right. Well, thank you everyone for coming today. If you have any questions, feel free to reach out to me. You will be getting the replay of this automatically, likely by the end of the day. And then I'll also be posting this to the past webinars section of YouTube, or I'm sorry, of WizeCove. Because Nicole is an intern, these also go on our YouTube channel. So if you want to share this with any other individuals in your agency, you are welcome to do so. All right, thanks Sherry, Colleen, Jackie. I think Matt was here, he didn't say anything, but thank you all for coming and we'll see you next time.
I just want to thank everyone again. Stay safe and we will see you next week. Bye-bye, guys.